For each of these techniques, begin by securely connecting the 4 numbered hoses with the proper connectors on the cushion. If the person is lying in a prone position and is unable to come to a seated position without assistance, utilize the common method of log rolling the person to the most appropriate side.
Fold the cushion with respect to the person's size. Next, position the cushion so that the upper edge is approximately level with and tight up against their waist. Now, roll the person over onto the ELK so that their midline is centered over the middle of the cushion. Unfurl the cushion. You may have to partially roll the person to the other side to accomplish this.
The next step is to assist the person into a straight-legged sitting position on the cushion. The correct position for the person is as if they were sitting on a chair seat with their buttocks in the back of the seat and the bend of their knees on the front of the cushion. To accomplish this, position yourself behind them and begin by placing your knees under their shoulders with their head upon your lap. Now, slowly support their shoulders with your knees and roll from left to right, moving your knees in the gap created. Continue this process until they are able to be maneuvered in a full upright seated position comfortably. Note, larger patients may require 2 or more assistants. Should the person be on the ground in a seated position, proceed by connecting the 4 hose connections in the proper order. Next, remove the outer stability bar and fold the cushion with respect to the patient's size. Ask them to lean on one side with the assistance of the caregiver if needed. Tuck the cushion under the patient's bottom to their midline. Next, unfurl the cushion as the patient leans to the opposite side again with the caregiver's assistance. Replace the stability bar and move to the rear of the patient to provide support for the lift. The final method used on an uninjured patient is for those patients with sufficient strength or ability to inch themselves back onto the cushion with the caregiver's assistance. The caregiver must then move to the rear of the person to provide the necessary support for the lift. Now that the person is in a seated position with the appropriate number of caregivers providing support, we can begin the lift. First, ensure the 4 hoses are securely connected to the properly numbered valves on the cushion. Also check the connection between the main hose of the 4-way controller and the airflow unit. Turn on the airflow by pressing the auto button. If possible, provide them with a chair, table, or other sturdy object to hold at their side. We can now begin the lift by pressing and holding the button numbered 1 on the 4-way hand controller. Continue holding down button number 1 until the cushion is completely full and the compressor stops. After checking the position of the person to ensure they are stable, continue by pressing and holding the button numbered 2 on the 4-way hand controller. Once again, hold down the button until the cushion is full and the compressor stops. Repeat this process with levels numbered 3 and 4, always making sure to properly support the person from side to side movement. With the cushion fully inflated to its proper level, it is now possible to assist the person to stand if able. For those who are unable to stand, it may be necessary to transfer them to a seated device such as chair, sofa, or wheelchair. An injured patient can be lifted on a backboard using the ELK. The ELK can lift the backboard to a height that allows for a lateral transfer to a stretcher or gurney. Before proceeding to use the ELK for a lift, make sure that the patient has properly been secured to the backboard according to your protocol. Begin the procedure by opening the ELK cushion and correctly securing the 4 quick-release valves as previously instructed. Using 2 attendants, slide the cushion under the patient. The cushion should be placed so that the patient's center of gravity is correctly placed on the cushion. During the lift, an attendant must remain positioned at the head and one at the foot of the patient to ensure that the backboard remains balanced on the ELK. Begin to inflate the cushion using the same process applied during a seated lift. If it is determined that the position or balance is not optimal for completing the lift, correctly reposition the patient and begin the lift again.
For those using the double ELK connector, first secure the connector hose. Then position 2 ELK cushions under the backboard and proceed to complete your balanced lift using the 4 buttons on the hand control.
The ELK can be used to lift a patient within a bathtub. First, correctly secure the 4-way quick-release valves as previously instructed. Next, open the ELK cushion and remove the stabilizer bars from the cushion. The cushion must then be positioned under the patient. There are several options for positioning. A patient with sufficient upper body strength can lift him or herself using their forearms along the upper edge of the tub, enough to slide the cushion underneath them from behind. Those with weak upper body strength may need to lean or slide forward so that the ELK can be placed under him or her from the side or behind the patient. Once the cushion is positioned under the person, proceed with a lift as previously demonstrated with one exception. Do not totally inflate each cell. Lift the patient only as high as necessary and ensure that the ELK performs the lift out of the tub.